Community Speak is a collaboration between the Urban and Social Policy Program at the School of International and Public Affairs and the Department of Biomedical Informatics, CUIMC, at Columbia University. The project works with a citywide network of community organizations and not-for-profit partners. The COVID-19 pandemic has revealed significant gaps in the available data cities need to effectively respond to both the health emergency and to the devastating secondary social and economic impacts of the crisis. This failure has been especially devastating for low-income families, the elderly, and small businesses. Without publicly available and detailed data, policymakers cannot efficiently and effectively target recovery efforts to the communities most in need or plan for future crises. Though there have been some efforts at collecting data throughout the pandemic, few have collected microdata through regular, repeated surveys of individuals, small businesses, and vulnerable groups so that changing conditions can be tracked and policy is informed by the data. Through regular surveys that are developed in collaboration with community organizations, Community Speak is collecting micro-level data over time for targeted policy intervention. Specifically, our surveys will regularly collect data at the scale of an individual person, household, small business, or organization. Collecting targeted individual level microdata through surveys of individuals and small businesses allows for an in-depth, differentiated, and representative sample, which allows us to understand the socioeconomic issues among diverse demographic groups and small business types. The data is key to designing public works projects and formulating policies, targeting interventions, and monitoring and measuring the impact and results of projects, interventions, and policies, especially at the city level. Our data will be readily available on digital platforms, such as the Community Speak website, to aid government agencies, local organizations, and researchers to develop targeted community-based programs and evidence-based policy. Survey data analysis and ongoing engagement with community organizations will enable city government officials and local community leaders to propose programs and formulate policies that can target needs and evaluate the impact of those interventions. From July to September 2021, we collected over 1,000 responses from our individual survey, including more than 750 valid responses, which we are currently analyzing for upcoming policy memos and reports. Some of the results from this round of the survey had not been previously discovered in macro-level analyses at the state or national level. Our survey found that Hispanic females overwhelmingly had more difficulty accessing transportation, paying rent or finding housing, and cleaning equipment and PPE. We saw that 73% of Hispanic female respondents also felt that they were not able to control important things in their lives. Another striking finding was that over 50% of households with children in the city did not have stable access to childcare. Some of our findings echoed the data appearing across the country as well, such as how Asians, and especially Asian females, disproportionately experienced or feared discrimination related to the pandemic. Not only do we plan on continuing to analyze and summarize our findings in reports and memos and visualizations, but we will also hold meetings with strategic partners, including our community-based organization partners, our small business associations partners, and our government partners in order to present our findings and recommendations face-to-face and brainstorm potential policy solutions and interventions. By building our strategic partner network, we aim to create a sustainable survey system in which microdata can be used for quicker response and recovery in other crisis situations. We will bring more stakeholders from all three sectors to the table to develop policies which focus on present and future needs of individual communities and populations. Community Speaks will empower New York City officials to plan for recovery. Specifically, this project will enable local leaders to define needs, identify vulnerable communities, assess the best method to deploy resources, and measure the satisfaction of residents by collecting critical data via surveys and carrying out analyses. Community Speak has developed a framework and practical tool for city governments and policymakers to collect, analyze, and share policy-relevant micro-level data. We're preparing the Community Speak data collection and analysis framework to train a cohort of cities from across the country, enabling their local governments to develop evidence-based policy in partnership with their residents. Data can serve as an extremely powerful tool to set city government priorities and inform decision-making and target new solutions. Community Speak strives to improve government performance and residents' lives, to enable this kind of policymaking and opportunity through data collection and analysis, and by providing evidence-based policy recommendations grounded in community involvement.